Immunizations and vaccinations. There is new data and research to support how important it is for us to get our flu vaccine every year. We're at Mile Bluff Medical Center to learn a little bit more, and my guests will include Craig Griffiths, who is the Director of Pharmacy here at Mile Bluff Medical Center, Nick Hewitt, Clinical Pharmacist, and Wayne McCarty, Director at Mile Bluff's Phillips Health Mart Pharmacy. From the Mile Bluff Medical Center here in Mauston, I'm Justin Riley, and this is Wisconsin Doctors. Welcome back to Wisconsin Doctors. We are here at Mile Bluff Medical Center, and we're learning a little bit more about vaccination, specifically the flu vaccine, what we've come to know as the flu vaccine, because believe it or not, flu season is coming. It'll be here in a couple of months. Perhaps it's already here in some places, so we're going to find out a little bit more. And Nick, as we head into the flu season, many of us are considering the benefits of getting what we call the flu shot. Can you tell us exactly what the flu shot does for people?
The point of the flu shot, as you'd expect, is to try and avoid getting the flu.
Right.
It's one that is usually geared against 3 or 4 of the most common strains of flu that are circulating, so you've got a pretty good chance of avoiding it. It takes about 2 weeks to kick in after you get it, so that's why we usually encourage people to get it earlier in the season before the flu is around. And it's basically an inactivated or killed version of the flu virus. So like with all vaccinations, your body gets exposed to it, learns how to defend against it. So again, hopefully if you get it, you don't get the flu, or if you happen to get one, you've already got some baseline immunity, so it won't hit you as hard.
Right. Absolutely, and so it's an inactivated version of the virus, so it
Right.
doesn't multiply and spread.
No, you
inside
can't
your
get the
body.
flu from the flu shot.
Right.
Even the nasal one, the non-injectable one, which is a live virus that's been attenuated, is the fancy word, but basically weakened, that cannot infect you. That one isn't really recommended anymore, just because it don't get the same response as you do from the actual flu shot.
Right.
And you want, if you're going to get a flu vaccine, you want it to work.
So now, Craig, what if there's somebody who's lived their entire life and they're 85 years old and they've never had influenza? Why should somebody like that still get the flu shot?
Yes, Dad. An 85-year-old who has been healthy all of their lives and never had any problem with illness still can benefit from the flu shot. In fact, as we get older, what happens is our immune system starts to deteriorate. And so just having that boost in your immunity and getting that immunity started has advantageous results for the individual that gets it. So yeah, anybody over 65, actually, as we start to get older and our immune system deteriorates, there's value in getting the vaccine.
It gets more and more important as you get older, right?
Absolutely.
Wayne, when will the flu shot be available? Because depending on where you go, it may or may not be available in certain places.
Well, it should be soon, though. I think we're going to see a rollout probably in September. Earlier is better to get your flu immunization, so as soon as you hear it's out, go ahead and come and make your appointments, make your arrangements. You can get them at doctors' clinics. You can get them at most retail pharmacies. Mm-hmm. The flu shot is very available, and we should be seeing it rolling out late summer, early fall.
And as you mentioned, as somebody mentioned, that it takes 2 weeks, I think, Nick, you mentioned that.
Right, about 2 weeks to kick in fully.
Right, so it's important the earlier you can get it in your system, the better shot you'll have of defending against it. Your immune system will have defending against it. Craig, some people have had, or have claimed at least they've had an aggressive reaction to the flu shot in the past. What's the cause of this?
Well, actually, when we give an immunization, the idea is to induce an immune response.
Right.
Whatever, in this case, the flu vaccine, we're trying to get somebody to react to the flu and build an immune response that will keep them from actually getting the disease. And by doing that, we're invoking the same immune response that you would if you had the actual virus and were infected by the virus. So it's not out of the question for somebody to react to the vaccine in much the same manner they would to the real virus, get the muscle aches, little low-grade fever, maybe a headache or even maybe some nausea or something like that with it. And it's just, your normal immune response to that virus and the presence of the virus in your system. It's not the flu, it's just your body building that immune response that they're supposed to in order to be able to fight off that virus.
But I would suggest that getting that kind of, those kind of symptoms is so much better than getting actual influenza.
By
so.
far, yeah. It's interesting because people think they're really sick.
Yeah.
Until you've had influenza, you're not really sick.
Right, yeah. Well, we got to take a short break. When we come back, we're going to talk a little bit more about side effects and some facts and myths about the flu vaccine. Stick around here at Mile Bluff. Welcome back to Wisconsin Doctors. We've been talking vaccinations here at Mile Bluff Medical Center. I have a fantastic team of specialists to talk more about that. We've been talking mainly about the flu vaccine. We're going to continue talking about that. Nick, what are some of the common symptoms or side effects that people have after getting a flu vaccine?
After getting a flu shot, and I know Craig touched on this a little earlier with the side effects, the first one is, well, usually it's a shot, so
Right.
your arm's going to hurt a little bit. Usually
Sure.
for a day or two it's sore, maybe a little muscles get a little swollen. That's just from the physical part of it. And as I mentioned, Craig was touching on, you usually get maybe a low-grade fever for a day or two, sometimes a headache or just general aches, and that's just your body's response to that. It's nothing compared to the actual influenza, which I think Justin's mentioned in the past. He had a loved one that had that. That's terrible. You're sick for a week. It's bad. Minor side effects from the flu shot, just little inconvenience for a day or two. And not everybody gets them. They sometimes get a flu shot and they're fine.
Right, right.
Yeah.
So it's common, but it's not abnormal if you don't get them too. So,
Absolutely.
Yeah. Wayne, what are some of the things that people can do to treat these side effects? I know that you're helping out a lot of your customers over at the Phillips Pharmacy. So.
Sure. Well, we would recommend some analgesics, ibuprofen or acetaminophen, which is common brands are Tylenol, Advil, also naproxen. Those things can all help with any injection site pain, or even if you have a low-grade fever or some minor discomfort, those will all help. I'd also suggest just taking it easy a little bit. I mean, a little rest and just make sure you're well hydrated and taking proper nutrition, the simple things, you know.
Simple things go a long way, in other words. So I want to make sure that we talk about this because there is a pretty big myth that's still floating around out there about vaccines in general, and including the flu vaccine causing autism. But that's not true. Craig, can you talk to us a little bit about where this came from, and is there any credibility to it at all?
Well, yeah. No, there is no credibility to begin with, but yes, I can certainly share about that. In the late 90s, there was a study produced by a doctor in England that he published indicating that he had 8 pediatric patients who had developed autism within a month after getting vaccines. The specific vaccine in this particular case being measles, mumps, and rubella. The study was substantially flawed. In fact, it was revoked later on, and he's actually no longer practicing medicine. But that's a sidebar thing. The reality is there have been several studies since. There has been no link between any of the components of the vaccines, the active ingredients, the inactive ingredients, including thimerosal, which was a preservative that was complained about for some time and thought to be the original cause. They've also done some statistical analysis of the rate of autism prior to the introduction of the vaccines into our society and the rate of autism after. And taking out various variables so that they could give them a legitimate estimate, there is no statistical difference between what we experienced before vaccines were available and what we experience now. The difference has actually started in the 21st century because we have better diagnostic criteria for autism.
Right.
It has nothing really to do with the vaccines. So in answer to your original question, no, there is no relationship between the administration of a vaccine and the development of autism.
Because we're recognizing autism just better now than we used to.
Absolutely.
So, Wayne, we just have a few seconds, about 30 seconds here, but I understand there's a difference between the flu and influenza. Can you talk to us a little bit about what that is?
Right. You know, we're treating an upper respiratory infection that can make you severely, severely ill, not to be confused with the stomach flu where you're laid low for a day or so. This is something a lot more dramatic and can make you very ill that takes you many days to recover from. It's very dangerous. It can kill you.
So flu is sort of a general term. Influenza is the real thing.
Real
It's
deal.
Real dangerous.
Correct.
So we got to take a short break. We're going to come back and continue talking about this here at Mile Bluff Medical Center. Stick around. Welcome back to Wisconsin Doctors. We've been here at Mile Bluff talking about the importance of getting your flu vaccine this year because the time is coming. And we've talked a lot about some of the side effects that people get and some of the mythical side effects as well, the ones that really have no credibility. Nick, are there any others that we haven't talked about here today that people think of as being side effects for flu vaccines but really are not?
There's a lot of myths or confusion regarding the flu vaccine and its side effects. The biggest one is that it causes the flu or it causes a cold. It cannot cause the flu. It's not an infectious version of the virus. And a lot of times, we talked earlier about the side effects. Those are similar to a cold, or you might have some aches or low-grade fever, but that's just reaction to the vaccine, a normal reaction. It's not a cold. Or a lot of times, because it takes a few weeks to kick in, they'll get the flu and relatively quickly after getting the vaccine because it hasn't kicked in yet.
Right.
So there's a lot of confusion regarding that, but it does not cause the flu. That's the biggest one. People worry about allergic reactions. That is a real thing, although it's very rare, and it's no different than an allergic reaction to any other drug, aspirin or a prescription drug or anything else that can cause an allergic reaction. There is some confusion also between the flu shot and the pneumonia or pneumococcal vaccine, which are entirely different, but why people confuse the two of those together. So that's one to make sure you ask your doctor or pharmacist about.
Sure. That's an important thing to note. And Craig, what are some things that people should take into consideration this fall if they're thinking of getting the flu vaccines? Because there's always new research that's out. So what are some things that you can talk about?
There's some new stuff going on with the flu vaccine. The first one is they've developed a high-dose vaccine, which we've had probably about 5 years now, Wayne. Does that sound right?
Yes.
But there's new data out now to suggest that at least in the long-term care population, so your nursing home population, there's advantages to the high dose. So your loved ones may be getting what we're calling a high-dose vaccine. It's a concentrated version of the influenza vaccine that gives them a bigger immune boost than you would get from a normal vaccine. The second change you'll see this year is that the nasal spray, even though it may be available, is not highly recommended anymore. It creates a variable response that isn't reliable to provide the immunity that you need. So you may still have the opportunity to get it, but it's probably not the most recommended or advisable this year. And then the last thing we'd share is just a reminder to everybody that there's an egg-free version. So if they've got allergies, that's not necessarily a reason not to get the vaccine anymore. There's a way we can vaccinate them and it will be perfectly safe.
Egg-free version of the flu shot, very important to remember. So if you're out there and you're allergic to eggs, that's for you. So I want to switch gears for just a minute. Wayne, we've been talking primarily about the flu vaccine. I want to talk about two other preventable diseases, meningitis and HPV. There's several different strains of meningitis right now, is that correct?
Right. There's the A, the C, Y and W, and then there's the B.
Okay.
B is sort of the set aside. Typically, we immunize against everything but the B. The B, we reserve a special vaccine for more immunocompromised individuals. And it's recommended that preteens 11 and 12 are immunized for meningococcal, and also a booster again at age 16. This bacteria resides in the nasal passages and the mouth, and it's very, very easily transmitted. People can walk around with it and be a carrier, but not necessarily ever get sick from it.
Right.
But the risk, if you do become ill and you do experience meningitis, which is an inflammation of the brain or the meninges, the lining of the brain stem, you need to be it's a terrible disease, and it could be fatal. So, so it's recommended people are immunized for meningitis.
Absolutely, and we got to take another short break here, but we're going to continue talking about immunizations here on Wisconsin Doctors at Mile Bluff Medical Center. Stick around. Welcome back to Wisconsin Doctors. We've been talking about the flu vaccine here at Mile Bluff Medical Center and vaccinations in general. And we talked a little bit about meningitis in our last segment and the importance of getting vaccinated against that. But Craig, I also want to mention HPV, standing for human papillomavirus. Yeah. We've always known since the vaccine came out that it's important for the young ladies to make sure that they get vaccinated, but that also that men get vaccinated. But the reasoning for men getting vaccinated for this has changed recently. You want to talk about that a little bit?
Yeah, well, as you noted, when it was originally marketed, it was marketed for prevention of cervical cancer in young women. And so we were giving it to girls predominantly. Well, then it was suggested we should give it to the boys just to prevent the cross infection and stuff like that. But more research is out now, and we now know that HPV is associated with over 20,000 different cancers for both genders. Because of that, the indications now go down to 11 and 12-year-olds for both the girls and the boys. Wow. And they encourage a two-shot vaccination process now. It used to be 3. They can still do the sequence of 3, but it's recommended at least for 2, at least 6 to 12 months apart, somewhere between the ages of 11 and 12. And the reason for that is we're seeing the incidence of the HPV-produced cancers and things like that starting at about 15, 16, 17 years old. So they're really encouraging us to start young with the kids to get them vaccinated.
Wow, that's very good information to make sure that you get your kids taken care of. Wayne, I want to talk a little bit about general things that we can do for our immune system, because obviously that's kind of the overarching topic today is our immunity. What are some of the other things that people can do to help boost their immune systems in addition to getting vaccinated, and how can the community pharmacist help?
All right. Well, I'll go back to the simple things. Rest and exercise, eating a good healthy diet. As far as what the pharmacist can offer beyond counseling on that, vitamin D is an important part of the diet. I really feel strongly everybody should be on a vitamin D and probably a multivitamin every day. Those are things that help to assure that your immune system is in good shape and it's strong. The retail pharmacist can offer, be a resource for these things, as well as we talked a little about immunizations, and we offer flu shots, we offer pneumococcal vaccinations, Zostavax for those that are over 60 years of age. All those things are important to be thinking about and reaching out to your community pharmacist for.
Absolutely, and so when the vaccinations become available, people can walk right in and get them from you.
Typically, some we do require an appointment. Sure. Sometimes there's some research that needs to be done as far as making sure they're covered. Right. The flu shot is covered by Med B for anybody who's over 65 and is a Medicare recipient. Okay. Zostavax is typically covered by a lot of insurances.
Okay, well that's good to know. And Nick, let's talk real quick about some folks who may have concerns that vaccines are not natural. How would you address these folks' concerns?
That's a good question. That all vaccines are built from something that occurs naturally as either a virus or bacteria. There's usually some small amount of preservative in them. They use some sort of chemical to either weaken or kill the infectious bug. But for the most part, they've limited a lot of there's no mercury in them anymore. Thimersal's been either decreased or eliminated. There's less preservatives, and the tiny, minuscule amount you're getting in the injection is not at all going to hurt you compared to what you ingest every single day, just eating food or drinking water.
Even the processed food that we eat on a day-to-day basis. Yeah, absolutely. And Craig, we just have about a minute left, but I think it would be good to talk a little bit about the overall impact of vaccines that we've seen over the years and what we know about them from past experience.
Yeah, I did some research for my own edification, so I was a little bit more prepared for this, but Back in 1964, for the first time, we vaccinated for the measles. Prior to 1964, about 400,000 children in the United States were infected with the measles every year. 1 in 500 of those kids would die. So that's 8,000 kids every year that died from the measles. About 1 in 800 of them would suffer some permanent, long-lasting effect of their measles: blindness, deafness, other illness, compromised ability to walk and mobility and stuff like that, muscle changes. And that's what, 20,000 out of a 400,000 group
Yeah.
of 400,000 people.
Right.
The long and the short of it is, in 2013, we had 167 cases of the measles in the United States, not a recorded death nor a recorded long-term effect of that. So that, I think that's one of the most pronounced examples of what being vaccinated can do to help our community, our country, and the health and well-being of our children.
Very well put, Craig. Thank you so much. And I want to thank all of my guests here today, Craig Griffiths, Nick Hewitt, and Wayne McCarty. Thank you so much for the information.
Yeah.
That's all we have for Wisconsin Doctors here at Mile Bluff Medical Center. We're inviting you to live longer, live better. We'll see you next time.